Jen. So it's Breast Cancer Awareness Month, and our last hour we talked about mastectomies, and now I'm joined by Dr. Heidi Richardson to talk about what comes next, reconstruction and breast surgery. So good morning, Dr. Richardson. Thank you for coming.
Thank you for having me. I guess I want to start this conversation with the fact that most women presenting with breast cancer are candidates for and choose breast conservation, meaning lumpectomy, I'm just having to remove the cancer. But what we're going to talk about today is a subset of patients that have more extensive cancer and are recommended to have a mastectomy. My job then as a breast cancer surgeon is to remove the cancer, number one, and to work with the plastic surgeon to do reconstructive surgery. So
I would think that there's a lot of not only physical implications, but also mental implications when it comes to this process.
Absolutely. So we really have to treat the whole person. This type of surgery will affect every part of them, implications for body image and even sexuality. So things that need to be addressed in even that first consultation.
Well, you as a surgeon, what is your goal? As a breast surgeon?
It's really to get back to life as usual. So yes. Hopefully this is just a bump in the road for them. It is a difficult process to get through, lots of coping to deal with their diagnosis of breast cancer and change in their bodies. But again, we want to get them back to life.
Great. So you're here this morning to talk about some of the things that you have seen, or some tips or things to take into consideration when it comes to breast surgery. And one of them is about having the conversations early.
Yes. So start the conversation early. My job, again, is to educate them about their breast cancer, to talk about need for chemotherapy potentially and even radiation, but also in patients that need mastectomy to be reviewing their options for reconstruction.
So great. So you went right into options and risks.
Yeah, so there are two main types of reconstruction for mastectomy. One is with implants and one is using your own tissue. I'll call it flap procedures, but it's the tram flap, deep flap, using your own tissue for reconstruction. And they carry very different, amounts of time in surgery, very different recoveries from these two types of reconstruction. Again, my job is to give them that overview and to have them start thinking about their options, and then they meet with the plastic surgeon and have a bigger discussion. We are blessed in this community to have really plastic surgeons that specialize in breast cancer reconstruction, so they can offer the full gamut of reconstructive options to patients.
So with that being said, so what are some realistic expectations for patients pre, during, and post one of these procedures? Mm-hmm.
So again, I talked a little bit about how different these two procedures are.
Right.
Implant-based reconstruction being the simplest, meaning a shorter amount of time in surgery, shorter recovery, but implant reconstruction doesn't have the longevity that using your own tissue does. Implants will need to be replaced in a woman's lifetime. Mm-hmm. So again, that's something that a woman has to consider when they're looking at these options. Tram flap, deep flap reconstruction, the flap procedures, again, more upfront surgery. Those patients might be in a 10 to 12 hour surgery, have a longer recovery, but there's longevity in that. So 20 years from now, that flap procedure won't need to be revised.
So now, are there time considerations or times between procedures that people need to think about, or does this not matter?
It does matter.
It does.
So the best time to do a reconstruction is in that same first surgery. Again, my job in those surgeries is to remove the cancer and the breast tissue, hopefully underneath the skin of the breast. So in immediate reconstruction, we can save some of the shape of the breast by sparing the skin. Sometimes we're able to keep the nipple areolar complex, and so that allows for a more natural appearance of the breast after reconstruction. And then the plastic surgeon comes in at the same time to do the reconstruction.
Gotcha. So it seems like why having those early conversations now it makes sense, because
Yes.
It all ties together.
But there are times where that plastic surgery, that reconstruction need to be delayed, or maybe a patient just decides, I want to treat my breast cancer right now. I don't want to have a lengthier procedure. I want to let them know that reconstruction can happen in a delayed fashion. So maybe 5 years from now they decide, it's time for me, I really want to consider that reconstruction. It's still possible.
Great. Thank you so much. For sake of time, we're just going to have to come back with more Creme 2 morning news and weather coming up after the break. Thanks so much. Thank you for coming.
Thank you.